Good day. I am Ann Mazikowski, President of the League of Women Voters of Central Delaware County. And on behalf of our league, I want to thank you for joining us for our hot topic, public health programs and policy in changing times. The League of Women Voters is a nonpartisan organization which neither supports or opposes candidates, but does encourage informed and active participation in citizenship, elections, and democracy, and works to increase understanding of major public policy issues and to influence public policy through education and advocacy. One of the ways we help fulfill our mission to empower voters and defend democracy is to offer presentations to inform the public and voters on important issues. This hot topic, which was coordinated through the Civic Education Committee, which provides opportunities for league members and the public to gain practical knowledge about how government functions on a local, state, and national level. The Civic Education Committee intersects with societal issues to enable citizens to practice civic and advocacy skills, becoming effective participants in the political processes of our democracy. This presentation is being recorded, and a link to the recording will be posted on our YouTube channel and shared with all those who registered for you to share. I also want to thank those who submitted questions, which were shared with our presenters. Our presenters have extensive backgrounds in public health. Unfortunately, one of our presenters, Lora Werner, is dealing with a family emergency, but our other presenter, Rosemarie Halt, is a member of our League of Women Voters and for decades worked in collaboration with the League of Women Voters of Delaware County, ILO, to establish a health department in Delaware County. Rosemarie has over 35 years of experience as a healthcare professional working in community advocacy and government affairs. As a registered pharmacist with a master's degree in public health, she focused her career on nonprofit and public health systems. As a health policy consultant with Children First, she focused on the Lead-Free Promise Project, a statewide coalition of more than 60 groups fighting to end the scourge of lead paint poisoning through public awareness campaigns and government programs that help residents get lead hazards out of their homes. She currently volunteers as chair of the Delaware County Board of Health. Rosemarie, we're turning the program over to you.
Thanks so much. And then thanks so much for being here. And I just want to again say Laura was very disappointed that she could not be here today. And she said she'll promise to do something else in the future for you, but it was just a totally unavoidable situation for her. And okay, thank you. So, yep, this is our introductory slide, and we can go on to the next one. So just want to give a quick overview of what we're going to go over today. But I do want to just note that any opinions expressed in this presentation are that of me as the Board of Health Chair. The factual information is from the Delaware County Health Department. And so they can't give specific opinions on like advocacy roles and things like that, but I can. So the Delaware County Health Department, what we're doing every day to protect the county, and we're going to go over potential impacts of the changes at HHS and CDC directly to Delaware County Health Department. And then how is the health department responding to potential current changes in programs and budgets? And what is the national public health efforts on the education and advocacy? And what are the state and local public health efforts in that area? Next slide. So just to begin with, we wanted to set the tone, and this is a critical slide, both locally and nationally, to understand what is the foundational public health services. And so every day, health departments do these. We're always doing surveillance. And so those from COVID would remember that. So we're always surveilling what's the current public health threat out there. And we're always preparing for emergencies, working on policy development and support, communicating and community partnerships, And then organizational and making sure our administrative competencies are up to par, and that we have accountability and performance management. So that's a basic structure all the way from the CDC all the way down to your local health department. And then from these, or the basic things that we all know public health does. So it's the communicable disease control. So for us every day, the health department has a team of case managers that works with people who have been reported through the state system to explain, and it reports to us all of the disease reportable conditions. And so we get a list of those daily, and we have to contact people, do the case investigations, and monitor them. Then there's the preventing chronic disease and injury. So for example, cancer prevention and asthma prevention. Environmental public health, that's actually the inspections of the pools and restaurants, wells, and those types of things that we do every day. And then we have maternal, child, and family health, and that's specifically around, could be for vaccines for children program that we'll talk a little bit about, and then also other maternal health programs that we have going on right now, which is our doula program is another good example. And then access to the linkages. So when is Delaware County Health Department successful? We are successful when you experience less spread of infectious disease, fewer premature deaths, including infant mortality and cardiovascular disease, diabetes, and less hospital visits. So we're like the behind the scenes people. When you don't hear us, you don't see us, that's a very good thing. But critical with hospital situations in Delaware County, and we facilitate partnerships to drive the long-term change. But financial benefits are connecting the residents with resources they need to improve their health and bringing investments back to the county, which we've been able to do successfully, bringing millions of dollars back into the county through grants and other supports. Next slide. So, one of the stresses has been the closure of 4 hospitals in 3 years from the Crozier Health System that was owned by a private equity firm. And there was a lot of things that happened. There was people that, didn't quite understand what the health department's role is, and that we could not prevent that. It's a private equity. It was in bankruptcy court. But we had a lot of work to do, on the other side of it. So for example, we had, wanted to make sure that we were connecting people who were going to the emergency rooms and making sure that the ambulance services were up to speed. 45% of our county EMS system was provided by Crozier Health System, and that was a major, major issue, and that we helped secure funding that gave some breathing room to the municipalities that did not have this in their budget for the year to be able to provide ambulance support to their areas, which they are required to do by law. It's not a county responsibility. It's the local municipality's responsibility to make sure there's EMS service in their area, which a lot of people didn't quite understand at the time. So, a lot happened in that time, and there was a lot of challenges, and we can go to the next one. So, we played a critical role. We had to, there's a thing called the Emergency Operations Center. And so that was stood up during this time period of the closure of Crozier. And that included a lot of supports beyond EMS, including healthcare facility. We had to partner together to organize community events to help people find primary care and access services. And we're actually still continuing those events on a regular basis. And then we had to share some surveillance and epi data with the state and other partners to, try to target some holes that were created by Crozier's closing. And then we have our wellness line, which we've had from the beginning, and it's done a fabulous job. And they were going full steam and still are answering people's questions and helping to direct them to their care that they need. And then we had jobs fairs. We participated and helped run some jobs fairs for the Crozier employees. And the Board of Health participated in numerous committees. I think there were 6 different committees operating, one of which was to actually figure out the remaining patients that were left at Crozier which towards the end was still about 100 patients that we had to find places for them to go. And many of them were difficult placements because they were on Medicaid. Some of the patients had complicated medical conditions, and the local hospitals were already pretty full. So trying to find spots for everybody was going until like a couple hours before Crozier closed. Not only were we finding spots, but we had to find ambulance services to get them there. And so that with those last couple of days was very, very trying for everybody involved. All right, next slide. But we've had a lot of accomplishments, right? So 89% of the callers report being satisfied. They've handled almost 25,000 calls in the last year, or from 2022 to 2025, sorry, which is a lot of calls. We've had over close to almost 5,000 community health assessments and community health improvement plan responses, and both of those plans are completed and active. And then we have 5,895 individuals were vaccinated in 2020 since 2022, plus the highest number of screening tests by the county health department. And we were in 2025, and we were highlighted by the Pennsylvania Department of Health as doing a great job on that. And we have licensed almost 2,000 institutional businesses and pools and restaurants in 2025. And then we've had some great, we've launched our kiosks, which is our 3-in-1 stop and shop testing vending machines across Delaware County now, and they've been very successful. Over 5,000 free public health products have been dispensed in 5 public health vending machines. Next slide. So what are our current challenges for the health department? And the biggest one is definitely uncertainty. It's really hard to plan a budget when the state and federal budgets have not been passed or in limbo. And that's what we've been pretty much dealing with this year. Even, on top of having the federal issues, we did have the state budget just recently passed, but that caused a hiring freeze across the county. And so we have not been able to hire key critical positions throughout that time period. We have gotten permission to hire some nurses and supportive roles, but the majority of vacancy positions that we have now, we can start to look into hiring them. But also the uncertainty, in planning the programs for next year is out there because we're still not sure what's going to happen federally. And then there's the faith in public health has been eroded by this administration because of the information that they're putting out to the communities that are questioning vaccines and other public health measures. And then navigating the complexities, we have 13 municipalities who sued to maintain their environmental health inspections. And that case has been decided. And basically the judge said, everybody has to play nice in the sandbox and you guys have to figure this out. So that's what we're trying to do right now. But it is another challenge because we're not sure if we'll have additional municipalities to cover in the upcoming year and what that would look like as well. Next one. So as everybody's heard in the news, the vaccines are a very special concern. There's a program called Vaccines for Children that has been highly successful in the United States. And between 1994 and 2023, it prevented over 508 million illnesses. It helped avoid over 1 million deaths and saved nearly $2.7 trillion in total societal cost. This program, along with several other programs, are in danger of being cut or severely not only cut, but the parameters of people who could be using the program will be most likely changed. As we mentioned, there's a lot of vaccine skepticism out there. And in Delaware County, we have seen this in the current kindergarten doses being decreased. So for the first time, we're under 95%, which is current kindergarteners getting Tdap was 94.6% in the 2024-2025 school year, 94.3% for MMR, We need 95% to have herd immunity. So we've just gone under that threshold. And so we're really trying to do campaigns and inform parents why it's so critical to have their kindergartners dosed for school. 1 in 6 national parents now report delaying or skipping shots, up to 1 in 10 nationally in 2023. So um, it's already starting to see what the misinformation campaigns are doing. And vaccine is, we have to rebuild trust for people, even though that we have decades of scientific studies proving that vaccines save lives. Next slide. So what are our potential problems for the health department? As I mentioned, there is major funding cuts. The proposed federal cuts is 50% cut to 3.6 billion cut from the CDC alone. And if that budget blueprint passes, we will be in pretty big trouble, and I'll explain that later. But the supplemental COVID-19 refunds are also at risk. And, they're still trying to take some of that money back, even though that health departments are using that for increasing their lab capacity, helping to build the epidemiology teams and preparing for emergencies in the future. That money is critical to help us be prepared. The shift of financial burdens to the state so that as the federal government makes these cuts, somebody has to pay, and the next person in the line is the states, and most states are not prepared to do that. A large part of our county health department funding is a pass-through system that goes from the federal government to the states. So even the state Department of Health would be in trouble because that's where they rely on their funding as well. And that's for things, specific programs such as TB control, infectious diseases, and things for gonorrhea and syphilis, for sexually transmitted infections, and then also, again, for vaccines. And then the policy changes that undermine public health authority and infrastructure. I mean, you're making huge program cuts, staff layoffs have happened in other Pennsylvania county health departments. And it's diminishing our capacity to really to address and identify emerging public health threats. So what are we doing in response? So we're working with the Pennsylvania Department of Health, and they have had regular meetings and helping counties to try to navigate the information that is coming out federally. We're trying to rebuild trust in the community. So our community health workers and teams are in the communities trying to have events and educational meetings with families. We're working with health professionals. So healthcare professionals in our area are very concerned. And so we are meeting with them and working on plans for additional communications, and then working with county council on budgeting, which, it's difficult, as I mentioned, for everybody because we just don't know what they're going to give us from the federal or state level right now. I do want to mention that if you could just go back real quick. I do want to mention that there's Pennsylvania did join the Northeast Public Health Collaborative, which is growing. And at the time, it was Connecticut, Maine, Massachusetts, New Jersey, New York State, New York City, and Pennsylvania and Rhode Island are all part of this collaborative. And the goal of the collaborative was in anticipation of the things that we're seeing right now. And so they are going to be we'll be making our own vaccine standards, for example. And, the problem, though, is that for federal programs such as Medicaid, they may choose not to cover certain vaccines that is not approved by the CDC and the FDA. And so that can make it really difficult for families who are then put in the difficult position of deciding to pay for those things themselves. All right, next slide. So what happens when the CDC and HHS aren't there? And I've mentioned some of this already, the funding areas. So it'll make it difficult to respond to health threats and disease outbreaks. There's staff losses that can't result in the lack of expertise for investigating outbreaks. So once, we have this group of people at the CDC who are the experts are not there for us to call, that makes it very difficult for us in certain situations, especially in conditions where this might be a novel virus that we are not familiar with. There's over 100 public health programs such as gun violence, opioids, climate health, and others that have been eliminated or significantly reduced already in this past year. HIV and AIDS research and disease prevention has been significantly reduced, and most recently they have eliminated even the recognition of HIV/AIDS as National Day of Recognition. Emergency preparedness and response capabilities are weakened, and again, I mentioned this. We are losing people that are what I call the disease detectives and the critical scientists that help us during outbreaks. And then, we're losing lab capabilities and detection. That was the biggest thing during COVID that, we saw in Pennsylvania and across the United States. There's very specific public health labs that just do they have the capabilities of doing certain types of tests. And, we did, when COVID hit, they were one of the few that could do those COVID tests initially. Your LabCorp and Quest generally can't. And so that's what we're losing. So we're losing also, proposed cuts to the NIH, which would terminate many, many grants in various diseases. That has already happened across the United States. And we're seeing a lot of institutions, particularly in Philadelphia, like Penn and Jefferson, and those who have significantly cut their research. Many, physicians and scientists have already moved to other countries to continue their research. So we've lost a large body of that knowledge. And the loss of experienced personnel and institutional knowledge. So, as I said, during COVID, I had people to call when I had questions at the state and federal level. And, having that person to call who is the expert in their area that can really walk you through what's the best practices is critical at a time when you have to make decisions quickly. Next slide. So I tell everybody, and thanks to the league, who was a big help in helping us get the health department. It took 2 years to actually physically build and, get staff, do all the things that we had to do to build a basic county health department. But we can't rebuild the CDC that quickly, even in 2 years. Once these people are gone, they're gone. Once the institutional knowledge, all of those things that we rely on, the structures, you can't rebuild that overnight. And so this thought that we could stand up all of these things at any time is just not realistic. All right, next slide. So nationally, public health, in fact, Lora and I were just at the American Public Health Association meeting, which was very interesting. It's the first time I can tell you that I've been at an American Public Health Association meeting where they have actually been militant. They came out and said, we are fighting for our lives here, for public health, for the lives of the people in our community. They stood on the stage with the heads of the American Academy of Pediatrics, the heads of the infectious disease, 40 different medical and healthcare professional societies. We're all in unison in this message. And so, they are actively working. There's have several lawsuits, combined lawsuits with these 40 healthcare organizations and the American Public Health Association to try to stop or slow down many of these public health threats. But the biggest threats that we have identified are around vaccine policy. And right now, COVID and Hep B have been significantly reduced in what healthcare professionals are being guided to be able to use those vaccines. There's so many, they're fighting the CDC and HRSA firings. They're working on a lot of environmental health rollbacks. I don't know if people are familiar, but there's just so much going on. But in part of this whole thing is that they have rolled back national standards on smoking, on environmental health, on air pollution standards, on standards for car emissions, you name it, they pretty much are rolling them back. Which I don't understand how that's making America healthy again. Cuts to public health programs and research, including epidemiology labs and the things I've mentioned before. All right. So how are we, local public health is responding? So we're just ensuring basic programming. So the goal of most of the county health departments that I've been talking to is that we're just going to try to keep the absolute basics running. There's going to be no frills here. It's going to be, what do we need to do to keep our local communities as safe as possible? So that means that we might have to cut programs that have been more educational, for example, in things like gun violence, because we just don't have the funding for it. And, if it's between gun violence and making sure somebody gets their TB shot, they're tough choices. Ensuring evidence-based guidelines for vaccines and all other issues are instituted. So with Pennsylvania joining that, the healthcare coalitions, that's one of the things that we feel comfortable in, that Pennsylvania will be doing the right guidance. And then we'll have to hire our own local, state, and local experts to fill the gaps that we're going to be missing at the CDC. And supporting research where possible. State and local county health departments' budgets are already small, but to the extent that there is availability of funding to pass on, they're certainly going to try to do that. And we're trying to advocate and educate. So there's a lot of policy implications. I used this slide at I presented the American Public Health Association on a couple things on this, but the policy implications are pretty big. When the next public health emergency happens, there's two big things. If you don't have consistent funding leading up to that emergency that makes sure that public health is strong and that they have everything that they need to be prepared. And in truth, as we know in Delaware County, we didn't have a county health department when COVID hit, and we had to rely on Chester County Health Department, who had the infrastructure and the trained employees and knew how to do emergency preparedness and case management and contact tracing. And, as I said, it took us 2 years to build that up, but we also had consistent funding during that time. There was the ARPA funding. We had funding coming from the state and federal governments to support the counties, and that enabled us to build up the infrastructure we needed to do our health department. But public health infrastructure is it's a constant balance between this funding and public health infrastructure. And the infrastructure that we have across the United States when COVID hit was less than it should have been. We are significantly less than many industrialized countries. Our local public health institutions have suffered funding cuts for decades, and many of them were pretty bare bones when COVID hit. There was a little bit of funding that allowed us to do some surge kind of work and build in extra capacity, but now all of that funding has been taken away. And so now many health departments are worse than they were before COVID hit. So we have to really think about, what does that look like for our futures? And what are we saying about public health and what we want, if society decides that public health is not something that's important, which would be a huge mistake. But if they do, and, we have to be prepared for those consequences. And I just have blatantly said, people will die. That's as easy as I could put it, because we've learned all these lessons from decades, for over 50 years. We knew what happens when people got polio, but this generation doesn't remember what happened when people got polio or got the measles or got the mumps. There's a whole group of people that feel like, everybody should just have herd immunity, but they forget that when you do stuff like that, there's a lot of people that die achieving herd immunity or have lifelong consequences. So I use the one example, of a cousin of mine who was born the year before I was, and his mom got rubella while she was pregnant, and he was born deaf and blind, and he suffered that for his entire life. And I was fortunate enough, to be born in a time when that wasn't a worry. And so I think that that's just one small example of how that impacts families, how it impacts communities, and how important it is to have the basic public health infrastructure there to help protect and educate and promote. Okay, next one. So what can the League of Women Voters do? So one point I just want to highlight it is 80% of the CDC funding goes to state and local public health. So when they talk about they're making government, they're cutting government, there's only so much you can cut CDC, but what people don't understand is that public health was restructured during the Reagan administration. And so these ideas of block grants was introduced. And so we have block grants for maternal child health. We have block grants for TB control, for emergency preparedness. They're all in these block grant things. And so CDC funding is, when they say that President Trump wants to reduce funding by 50%, that's reducing funding that comes directly back to our counties and states. And so, right now we haven't had to pay anything for a health department in Delaware County. Most people don't understand that. For the first, since we started in 2022 to 2026, we were able to set it up that we did not have any county dollars having to go into the health department. We were able to get lots of funding from other places. But in the budget, a third of our money comes from the state and a third comes from the federal government. And starting in 2026, a third will come from the county. And so that will be an important thing to consider, as if the federal government cuts what they're giving us even by half, that would be a significant decrease to what we are planning on. So what we're asking is for advocacy, because the health department can't specifically advocate for these things, but we're asking that, we're really looking for Congress, to fully fund, just flat fund, keep what we've had. We're not asking for increases, just keep what we have. And then the other is to protect vaccines and demand protection from the MAHA movement that is really spreading this information. And then locally, keep the pressure on that the state maintains its funding. And if the federal government cuts theirs, they're, to maybe possibly increase funding to public health, and demand laws that protect vaccine access and require school vaccinations, because they're at jeopardy right now across the United States and in Pennsylvania. Next slide. And this is just some resources I gave if you want to do more research or check some of the information that I provided today. And with that, I am finished my portion of the presentation, but I know there was a lot of questions, so I wanted to leave time for the questions.
And Rose, I was able to join here.
There's Lora.
I came in late, but thank you. That was an amazing job, and just shows what you bring to this. And I just have to echo here how important the League of Women Voters has been to this department and to all the work we do, and say thank you. And anyway, just wanted to come on for the question part if I could.
That's great, Laura. Thank you.
So thank you for the presentation. And you did answer, and I appreciate that, and we appreciate that you answered a lot of the questions that were submitted. But I know there are a few people on here who probably would like to ask a few questions. So we're going to ask you, if you could, to use the raise hand function, and we'll call on you for you to ask your question. And if you don't know how to do that using the digital one, just raise your regular hand. Okay, we have Kathy. Kathy, there you go.
Hi, Thank you so much, Rosemary. That was really amazing, chock full of information. And we'll be sending the links out that you have in your last slide. We'll send those
Mhm.
out when we send out the link to the recording. Um, I'm looking for places that you suggest we as citizens can go to find out good, reliable medical information now that we can't really, I think, trust the CDC sites and the NIH sites.
I'll start and then Laura, you throw in. I was going to say the Pennsylvania Department of Health website, they are committed to presenting scientific evidence in their site. And because we've joined that collaborative, everybody is committed to follow the 2024 vaccine schedule. And so I think that's for at least for vaccines that we're focusing on. And then I would also look to like the American Academy of Pediatrics website. Look for the American Academy of Infectious Diseases and other healthcare professionals. The American Pharmacists Association has a lot of information as well. So all of those organizations have committed to present the science as they know it, as we have evidence for at this time. And I'm still waiting for the evidence for all the things that have been put out in the last 2 weeks because I don't see anything from ACIP that supports what they're telling us to do. But Laura.
Exactly right. I mean, I think we want to be reassuring that at the local level and the state level, we are holding the line and we are still going to be evidence-based. And the information that we're going to be sharing is still based on science. I know that there is going to be concerns about what's coming down through the federal level, and that will affect potentially our ability to reimburse for different things because our grants, that are, like Rose mentioned, are trickle down from the federal level. So for the next year, again, we don't expect changes, but in the year after that, we may not be able to vaccinate in the same way that we have been with our funds. But in terms of what we present and share on our website and what we rely on from the state website will still be intact. And also those professional organizations that Rose mentioned, in addition, American Academy of Family Practitioners. There's a whole list of them that Governor Shapiro mentioned in his press release this season that we will be continuing to rely on for good.
Yeah, and I should mention that the Delaware County Health Department has a great website. And so that's another great place to look for information.
That's helpful. And as you know, we do have an issues page on our website dealing with health. And so if there's things that you think we should have more or highlight more on our page, let us know and we'll certainly do it. And we'll try to revisit it. It's one of the things we want to do starting in 2026 is to look at everything that we have and see what we can do even a better job of communicating information. So we want to be a partner. Any other questions? Olivia, you're on mute. Just take yourself off of mute.
I know, Rosemarie, you've heard me talk about this many times, but this is sort of bringing it for Laura and as well, is the area of mental health is a great concern of mine. And I worked in mental health for many years as a nurse. And so I find myself watching state hospitals gone and then, everything that we seem to think we have. And yet it seems to me there's a need now more than ever for mental health care and an ability for people to be able to do something that they can afford to do as well, to be part of it. It's not just, is it open, but can you do it in a way that people can afford to come to it and ask for help? And it seems like a lot of the violence we have might be solved as much through mental health care as police. So does the county have anything in mind? Or ways that they think they can do something now that Sacred Heart's gone, and now do we have anything in Delaware County?
You're right, Olivia. This is a horrible gap for all of us. And we've seen this problem with mental health care being separated from what we, traditional healthcare, and they need to be together, right? But everything about our health system has made this artificial barrier between those things. As part of our community health assessment at the health department, we came up with 3 highest priority work areas that we wanted to focus on in the next 5 years. And one of them is whole person care, which envelops the idea of mental health. And what can we do with partners to try to continue to advance the availability of mental health supports and programming in the county? So, we have to share that responsibility at the health department deeply with our human services partners. Again, these barriers and these silos that exist in this space, but we're working with the county partners in human services together on this work group. And we have plans in some areas to see what we can do to increase, for example, the availability of mental health first aid and all of these things, and working with schools. And we're doing programming with some of the middle school and high schoolers to, again, try to get people at younger and younger ages. And as part of our work across the county related to the collapse of Crozier, we are trying to continue to connect people to care who lost care, whose mental health providers were part of the Crozier health system and then they lost them, right? So we've been doing a lot of work to do that kind of thing, a lot with MVP in that regard. But as you know, the county's only inpatient crisis center was closed when Crozier was closed. And so the county is in the process, has selected a new provider, and the provider is now looking for a physical location and to stand up that as well. But it feels like a lot of different pieces that aren't as coordinated as they could be, and there's not enough of it, but there is that desire, and we are attempting at the health department to be that connector of some of these different pieces.
Great.
And you're very welcome if you want to be part of that whole person work group. We welcome anybody to be on our what we call our committees, our CHIP committees, to advance this work together.
I would be happy to do that. And at one point, I worked for a Fort Logan Mental Health Center in Colorado, which is probably the best mental health hospital system in the country. And it was amazing what they did and how they brought the whole families in together and the communities together. So, when you were admitted only on floors where you would have neighbors and other people. So you'd have the next set, everything was done to build more. And at that point I was working with children. So unfortunately, one of my jobs was that, sledding with them and things like that too. But the idea was that you had to continue life. It's not that it's not to isolate you. It's to find a way that you can still function within the system.
Lora,
I hope the county really does work on this, because I think it's such a huge issue. And not that I don't think that COVID and lots of other things are important too, but I think mental health is just as important.
Lora, can I ask you how can people get involved in those committees or those groups?
You're welcome to reach out to Rosemarie, and we'll make sure you get connected. You can always call our wellness line, that number that you can access any portion of the health department, any of our services, our call center reps. You just tell them I'm interested in this and I want to work in it. And they'll find you. So any way that you like, we'll make it work. But yeah, those 3 priority areas that we set: whole person care, the other one's chronic diseases, and the last one is maternal, parental, and infant care, that maternal health crisis work that Rose was talking about.
I see another hand. Thank you. Linda.
Yeah, Lora and Rosemarie, are you, speaking of mental health, are you aware of any emergency intake mental health services that are in the county right now? I mean, even private, if someone were to have an emergency intake?
Do you mean for in-person care? Yeah, there's no inpatient crisis care in the county any longer. We have to transport out to Philadelphia or to Chester County. I think it might be. Isn't there something, Rose, in Chester County too? Yeah. But there are, I believe, private care, inpatient care that's not crisis based. I don't have that list off the top of my head though.
We do have the crisis line. So if somebody was in crisis,
the mobile crisis is still functioning at the county level, still funded. The L1 providers will come out and meet with a family with a person in crisis. Yes.
Okay, so it is mobile crisis, right?
mobile crisis,
All right.
correct?
Thank you. Thank you for that information. I appreciate it.
Towards the beginning of your presentation, Rosemarie, you gave an example of something that would have to be cut back, like gun safety programming. I just wanted to let you know, and maybe you do know, that in June, at the League Convention, Pennsylvania League Convention, the Pittsburgh League had done this big study dealing with the gun safety part of it, and the local leagues did a concurrence about it, and that made it to the state level, and it did pass. So again, there are some resources league-wise that we could help with, but where would it? So since that's going to be a gap, another gap, where do you see us helping to work on that? Would that be through the district attorney's office or the?
Well, I'll answer, and then, but Laura probably has a more specific one for the health department. So I use that as an example, but keeping in mind, because of the uncertainty, we just don't know what funding is going to be available. And so, given that gun safety and gun violence was cut at the CDC level, it's very possible that the funding that would come to the state and to the county health departments for that kind of program would probably be cut, and we wouldn't, may not at that time be able to fund it. But we don't know any of this, right?
Mhm.
So it's kind of like this shell game. We're not sure where our cuts will have to be, and Laura is on the front lines of trying to make some of those decisions.
But just to add on to that, as a new department, that is Delaware County Health Department had not started doing violence prevention work as of yet. So we are not in that way directly impacted by changes that could trickle down in terms of that funding source at the federal level. In the county here, you're right, Delaware, the district attorney's office is a great place to go to partner. They are doing a lot of work still in that area, especially in Chester, and have seen some successes there. So either the district attorney's office or some of the nonprofits there that my brain isn't working. There's one that's doing really well in that space, and I'd have to think about it and come up with that later. You're probably already familiar with them, but I think there's definitely room for that work still with other partners.
Great, thank you. Yeah, coalition building is a hot topic right now, and to do what we can to keep whatever we can going via
So important.
coalitions. So thank you.
I mean, that's why you're so powerful and effective. It really matters.
Thank you. Any other questions?
You had one. I can also add from the Q&A that you'd shared ahead of time
Okay.
about Eat Safe PA. Someone was
Yes,
asking
yes.
about that. I wanted to share that before I forgot. That is an app that was started at the state level for the Pennsylvania Department of Agriculture to put food safety and inspection information in. What our environmental health program understands is that will actually that app is going away. It's going to sunset. They're not going to be using it anymore anyway. The state is transitioning to something new, which I think is like fresh something. I have to, but it's this is one of these things that unfortunately is a little bit of a siloing where whatever the state has will only have the state inspected restaurants anyway. And so for jurisdictions like ours in Delaware County, where we are doing our own inspections, our information will not be part of that new state app either. But all of the Delaware County inspections are on our website. I can share that link after the call. You can search any of that information publicly at any time, and you can see it on your phone. It's not mobile accessible on your phone as well. It's not quite as streamlined as an app. Maybe we'll get there at some point. But there will be those two different sources of information. I think another person had asked ahead of time, could we encourage every jurisdiction to put their data into the state system? Because of course, here in Delaware County, we have the 13 that sued to still do it themselves. They're not in our database and they're not in the states either. I wholeheartedly agree that this is important. This kind of transparency of information is what makes everyone do a better job and highlight safe practices. In these legal negotiations with these municipalities, we have been trying to encourage the judge to put this as a stipulation in writing that these other jurisdictions will report in some way publicly what they're doing as well. I have not been successful in getting that as part of any of this to date. The court system has not been supportive for us, and I was it's not gone our way or the way we've been asking. But maybe we're in a new place now, and I'm hoping that maybe some of these jurisdictions might be interested in that, because I think it's actually something, even if they're doing their own, we're doing our own, it's that sandbox. We can do it together, and they can, making that information public helps everybody. It will help them too. So maybe,
Right. Once again, that coalition piece, hopefully.
yeah.
And we do have a legislative advocacy committee. Our chair is actually on this call, Jodie Mayberry. So again, if there's legislation or advocacy that you think we should maybe push for or work together on, please let us know.
I think asking those 13 municipalities to provide the information of the inspections that they're doing in those communities, because everybody deserves to know what's happening at their local restaurants and pools and those types of things. And so I think that's vitally important. And if they're willing to share it, I think they should, because you're paying for it.
Right.
Can I just ask Ruth McDermott, you're on this call and I know your camera's not on, but could you unmute yourself and talk about the Mid-Atlantic Center that you put in the chat? I ask only because the chat is not part of the final video that goes up. So people who watch the recording won't be able to know what you're speaking of in chat.
Hello, you caught me in the middle of making soup while I'm listening to this great webinar. Hi, Laura. It's so great to see you. We are the part of the Pediatric Environmental Health Specialty Unit National Network, and at this point, we are funded by the federal government.
Who is
And
who is we?
the Mid-Atlantic Center for Children's Health and the Environment. And we are located at Villanova University, and we are a team of nurses and nurse practitioners and nurse midwives, and as well as referrals to other providers to address environmental exposures and risks of children and people planning on having children. So that would also include men. So it's, women, families. I think of it in terms of families. So we are available. You can Google Mid-Atlantic Center for Children's Health and the Environment. And as I said, I'm making soup, so I can't think of the name, our phone number off the top of my head. But thank you.
And Ruth, a couple of years ago, I think you did a program for the health committee that.
Yes, it's about natural gas coming through the
Right,
county.
exactly. So yeah, we have that link. So if this would be an interest to do a program on this, let us know.
We would be happy to.
Okay,
We'd be happy to.
sounds great.
So,
Because there's a very active environmental group within the county and
yeah.
with the league banner. So we're always looking.
But we can address some of those things to kind of help the health department, and we collaborate with folks in the health department.
Very fortunate to have the Mid-Atlantic Center here serving our county. I've enjoyed working with you, Ruth, over the years so much.
Yes.
Great to see you too.
Yes, it's mutual. So anyway, thank you.
Thank you so much. Are there any other questions? The only other one that I can think of, and I'm not sure where this would fit in, but both Kathy and I attended a overview of a study dealing with health for the LGBTQ group. It was Pennsylvania-wide study. They talked a little bit about what's happening in Delaware County. I found it really enlightening. I had no idea. And unfortunately, the number one finding of that study for that group happened to be violence related. That was their number one health issue. Does the health department interact with that community? Have you seen that study? I guess is what I'm wondering.
I don't know if I've seen that study specifically. I know that really values being able to support that community. And one of the ways we've been doing that is through working with the AIDS Care Group and their Mosaic Health Program, which you're probably familiar with, that specifically is built around supports for the LGBTQ community. So that violence aspect, again, is in that part of the work that's so important, but we haven't directly developed programming, or we don't have staff that are working in that space specifically at this time at the health department.
And again, on the silo piece, just recently read that now the county council has brought the discrimination policy past that. So just see some cross things, but I don't know if Kathy wants to add to what she heard in that presentation.
It was an amazing presentation, and we do have a link to it. So I'll make sure we add that link to that study. I do have a question for you, Rosemarie. You mentioned this in your presentation, and then I saw an article in the newspaper about your vending machines, which is such a novel idea. And there might be people who don't know about that. Would one of you like to explain how that works?
Sure, yeah. Do you want me to do it, Rose?
Yeah, you can do it.
Yeah.
Yeah.
I mean, we're so excited about these things. Yes. So there's 5 of them right now. There's one at the Yaden Health Center for the health department. There's one at the Keystone First Wellness Opportunity Center in Chester. There's one at 69th Street Terminal. There's one at Delaware County Community College in Marple Township, and one at Media Government Center. And these are 24-hour for the most part. And 69th Street's closed for like a couple hours in the middle of the night. But just you go up there, you fill out punch in a couple things into the machine, and you can get the supplies that you might need like for free. So it's like a first aid kit, it's Narcan, it's test strips, it's what else was I think COVID tests, the at-home ones. There's also a lab-based test that you can take, and then you can return it back to the machine, and you'll go to the lab that way. You can do it via an envelope, via express mail. There's also STI tests in there. I mean, we're trying to meet people where they are with supplies that can protect their public health. And we've really got really great response about how this is really meeting a need. So we've been able to do this with grant funding. These are leased machines. So, we're hoping to continue to stay in the funding and even expand it. We're doing our latest direction for support is through the opioid settlement funds, due to the harm reduction nature of a lot of what's in the machines, that we're working to use that funding source to keep us going.
And they got to present at national conferences about the great work of these vending machines. So
people love them. The county did a little video about these things, and it's gotten the most views of any video that we've done in the county ever. It's like 10,000 views of this video. So maybe we'll send a link for that after after this meeting, because it approaches it with humor, but it's like fun too. That you can have public health supplies that are that available.
It's great.
Thank you. Looking at the time, we try to keep these programs to an hour, but any last minute questions before we close? Good? Okay.
Thank you very much.
our pleasure.
Thank you.
For
I
all
know
your-
Anne has a few words to wrap up.
Yeah, and of course, now here we go. I do. I wanted to thank our presenters for sharing your expertise. It's been really enlightening for us and very helpful. I also want to thank all those that registered for this presentation. And as we stated, we're going to be sending you the link to the recording, and now we have a lot more additional related resources to share. We're going to hope that you join us for future programs. To begin the new year, our next event is our 2026 gathering, looking forward and celebrating our league. It's being held on Saturday, January 10 at the Springhaven Club, which is located in Wallingford. The purpose of the gathering is to celebrate our efforts in 2025 and to share plans going forward in 2026. We're also having a presentation at that event, and it's about the League of Women Voters Unite and Rise initiative, which aims to build a movement and coalitions of 8.5 million individuals to unite and rise up against anti-democratic actions. This initiative was launched in May 2025 when the League of Women Voters declared that our country is in a constitutional crisis, and it will run until the 2026 midterm elections. This initiative is part of our Women Defend Democracy campaign. And our events are posted in our calendar of events and on our website at lwvcdc.org. Want to thank you for your interest in the work of the League of Women Voters.
And thank you for presenting and for your keeping up this hard work against all odds. We appreciate it.
Thank
And
you.
back there at you. Exactly.
And happy holidays to everyone.
Recording stopped? Yeah. Great. Thanks.